everyone, I am Archana Lakra, roll number 17. So here I am going to tell you about anticholinergic agents. There are various anticholinergic agents as antimuscarinic agent and anti-nicotinic agents. In anti-nicotinic agents, there are first ganglion blockers also called as NN blockers and second neuromuscular blockers also called as NM blockers. Generally, anticholinergics refers to antimuscarinic drugs. So, antimuscarinic agents, also called as muscarinic receptor antagonist, these drugs blocks muscarinic receptor mediated action of acetylcholine on heart, CNS, smooth muscles, and exocrine glands. Atropine and scopolamines are belladonna alkaloids. Atropine is obtained from Atropa belladonna and scopolamine from Hyoscyamus niger. Mechanism of action: both natural and synthetic drugs competitively block the muscarinic effects of acetylcholine. Now, classification of antimuscarinic agents. It includes first natural alkaloids. Natural alkaloids, it includes atropine, scopolamine. Second, semi-synthetic derivatives. It includes hyoscine, butyl bromide, homatropine, ipratropium bromide, and tiotropium bromide. Third, synthetic antimuscarinic agents. It is used as mydriatic. It includes cyclopentolate, tropicamide. Second, it is used in peptic ulcer. It includes pyrazapine, talanzapine, clidinium, propantheline. Third, it is used as antispasmodic. It includes dicyclomine, welthamate, flavoxate, oxybutynine. Fourth, it is used as pre-anesthetic agent. It includes glycopyrrolate. Last, it is used in Parkinsonism. It includes benzhexol, benztropine, biperidine. Now, atropine. Atropine is the prototype drug and the chief alkaloid of belladonna. It is the tertiary amine. It blocks action of acetylcholine on the muscarinic receptor. Atropine is administered by topical, oral, or parenteral routes. Pharmacological action of atropine. First, on CNS. In therapeutic doses, atropine has mild CNS stimulant effect. It produces anti-Parkinsonian effect by reducing cholinergic overactivity in basal ganglia. It suppresses vestibular disturbance and produces anti-motion sickness effect. Large dose can produce excitement, restlessness, agitation, hallucination, medullary paralysis, coma, and death. On CVS, at low dose, atropine causes initial bradycardia due to blockage of presynaptic muscarinic autoreceptor on vagal nerve endings. In therapeutic doses, tachycardia is seen due to blockage of M2 receptor of the heart. It also improves EV conduction. In high doses, flushing of the face and hypotension may occur due to cutaneous vasodilation. Third, on glands. All secretion under cholinergic influence are reduced due to blockage of M3 receptor, that is, sweat, salivary, nasal, throat, bronchial, gastric, lacrimal, etc. Milk and bile secretion are not affected. The skin and mucous membrane becomes dry. Fourth, on eye. It causes paralysis of constrictor pupillae by blockage of M3 receptors, which induce passive mydriasis. Atropine also causes paralysis of ciliary muscle, leading to loss of accommodation by blocking M3 receptors, which induce cycloplegia. Effects on eye last for 7 to 10 days following topical administration of atropine. Now, fifth, on smooth muscle. In smooth muscle, first, JIT. Atropine decreases tone and motility of the gut but increases sphincter tone and may cause constipation. It also relaxes smooth muscle of the gallbladder. Second, on urinary bladder, atropine relaxes detrusor muscle of the bladder but increases the tone of trigone and sphincter. May cause urinary retention, especially in elderly men with enlarged prostate. Third, on bronchi. Atropine relaxes the bronchial smooth muscle. It also reduces secretion and mucociliary clearance resulting in mucus plug that may block the airways. Now, pharmacokinetics. Atropine, scopolamine, and most of the synthetic tertiary amines as well absorbed from the conjunctiva and GI tract are widely distributed all over the body, crosses blood-brain barrier, partially metabolized in the liver and partially excreted unchanged in urine. Atropine substitutes. Atropine act on all subtype of muscarinic receptor, but atropine substitutes have selective or relatively selective action on a particular organ, hence produce less adverse effect than atropine. Now, first, atropine substitutes used in the eye. It includes first homoatropine. It is semisynthetic atropine derivative, less potent than atropine, and duration of action is 1 to 3 days. Second, cyclopentolate and tropicamide. They are synthetic atropine derivatives with rapid onset and shorter duration of action than atropine. Action of cyclopentolate lasts for 24 hours. Tropicamide is the shortest acting and action lasts for 6 hours. Second, as antispasmodic. It includes first, dicyclomine. It is tertiary amine. It has antispasmodic and antiemetic properties. It is useful in dysmenorrhea and abdominal colic. Second, vilthamate. It is tertiary amine. It has antispasmodic effects. It is useful in intestinal and urinary colics. Third, oxybutynine. It has selective action at M1 and M3 receptor in urinary bladder and salivary gland. It has vesicoselective action, useful for relief of spasm after urological surgeries for increasing bladder capacity in paraplegic and nocturnal enuresis. Fourth, tolterodine. It is more selective for urinary bladder than salivary glands, hence dryness of mouth is less. It is used to decrease frequency and urgency in detrusor overactivity. Fifth, flavoxate. It is similar to oxybutynine, used to relieve urgency and frequency due to cystitis, prostatitis, or urethritis. Sixth, derifenacin, solifenacin. It have selective action on urinary bladder, useful for relief of spasm after urological surgeries. They are longer acting than oxybutynine. Oxybutynine, flavoxate, tolterodine, derifenacin, and solifenacin are vesicoselective anticholinergics. Now, dotaverine. It is not an anticholinergic agent. It inhibits phosphodiesterase enzyme. It is used as antispasmodic for relief of uterine spasm, intestinal and renal colic. Now, the third is ipratropium bromide and tiotropium bromide. They are quaternary compound administered by inhalational route. They have a selective action on bronchial smooth muscle, do not affect mucociliary clearance, and tiotropium is longer acting than ipratropium. Dryness of mouth is a main side effect of this agent. Fourth, pyrazipine. It has selective action on gastric acid secretion, useful in peptic ulcer. Anticholinergic side effects like dryness of mouth, constipation, tachycardia, and urinary retention are rare. Fifth, benzhexol and benztropine. They are centrally acting anticholinergic agent used in Parkinsonism. Sixth, glycopyrrolate. It is quaternary compound. Central side effects are rare. Used for pre-anesthetic medication. 7. Propantheline. Useful in peptic ulcer and as an antispasmodic. Rarely used at present. 8. Clydinium. It is quaternary compound, has antisecretory and antispasmodic properties. Useful in peptic ulcer and irritable bowel syndrome. 9th, hyoscine butyl bromide. It is quaternary compound, Available for oral and parenteral administration. Used as antispasmodic for relief of esophageal and GI colic.